Hi, I'm Dr. Batsheva Marcus, and I'm hoping some people will be joining me live to talk about medications. We don't do enough in terms of understanding how medications work, and people are really hesitant to go on medications. There's so much social stigma to them. So in the next 15 or 20 minutes, I'm going to try to break that down a little bit. I'm going to try to give you an idea about maybe a slightly different way to think about using medications. And the kind of medications I'm talking about are the anti-anxiety medications and the antidepressants. We have so many odd and antiquated ideas about medications, those medications. I'm always sort of shocked. I feel like as a community we may have gotten past it. Oh my God, can you hear the garbage truck in the background and the stomping upstairs? This is kind of challenging, but it's going to be okay. So we have a really weird idea as a society. So what I really want to do in the next 15 or 20 minutes is just talk about how we think about anti-anxiety and antidepressant medication. And maybe if we think about it a little differently, it'll let you guys let you guys have an idea of whether or not it may make sense for you, and maybe a more rational way to make the decision about it rather than kind of our knee-jerk reaction about medication. So let me just talk about myself for a minute. I am probably the worst offender. I mean, we have a rabbi who often talks about the fact that when he gives sermons, he says, I'm talking to myself and I'm letting you listen. And a little bit, I'm doing that as well, because I am trying to, like everybody else, we're struggling with a really hard time, and I'm trying to sort of reframe this whole idea of medication. So I haven't slept. I mean, actually I did sleep last night, but I haven't slept for a lot of nights. And I know when I use Xanax, I sleep better. But I try really, really hard not to use Xanax. And even though I know it's perfectly appropriate to use it when I need it once in a while. And I think I fall into a lot of the same situations that a lot of other people do. So I'm now gonna maybe reframe it, and maybe by talking to you guys, I'll also be able to reframe it for myself, when to make a decision and how to make a decision to use antidepressants and anti-anxiety medications. So let's start by my defining for you a little bit about when I say anxiety and when I say depression, what do I mean? So depression, I think people know, you feel very sad, you may be crying all the time or not crying all the time, or sometimes you just feel like you can't get out of bed, or you're feeling lethargic. Sometimes it's just this sort of general sense of I'm walking through the world feeling like nothing's really worth it, or nothing's really helping anybody or anything right now, and that would be depression. Anxiety, which is something I'm much more familiar with personally, is this sense of, oh my God, the same thing keeps coming up, and I'm thinking about it, and it's making me anxious, and my talking goes even faster, and I have too many things on my plate, and I am not able to sleep, as I just described, or I'm not functioning as alertly as I usually am. Anxiety is a feeling of there's too many things sitting on my shoulders and I can't handle all of them. So that's depression, and that's anxiety. And there are medications that are super, super helpful with these conditions. And the reasons people don't want to use the medications often, I hear again and again the same reasons from patients or even from friends. And some of the things are sort of very practical. I don't want to get addicted. I do not want to get addicted to a medication. I'm afraid I will become dependent on a medication. I think it's going to flatten my personality and make me kind of an uninteresting person if I go on anti-anxiety or antidepressant medications. And those things are not really true. I mean, to some degree they may be, and I'll touch on that, but I think our fears of those things are huge and maybe not exactly as reliable as, or they're not actually as true as we tend to think of them. I do want to give a little bit of a caveat here. Again, I'm Batsheva Marcus. I'm the clinical director of Maze, and I'm talking about medications, using anti-anxiety and antidepressive medications, especially when things get hard, which they are now for pretty much everybody. I am not an MD, and if you are thinking about going on medication, again, an anti-anxiety medication or antidepressant, you should definitely seek out your medical provider and get information from them about specific drugs and to get a prescription. And I'll talk more about that at the end. But I will tell you that the concern about medications being addictive or becoming dependent on them tend to be a little bit overblown. The other reason I hear from patients about why they don't want to go on anti-anxiety medication or antidepressant medication is that, here's what they say. They say, it's not that bad. I don't think it's that bad. Like, I think it has to get really bad for me to go on one of those medications. And I'm functioning. I'm getting out of bed in the morning. I'm not falling apart. It's not that bad, is what I often hear. The other thing that people say is, well, it's appropriate for me to be sad right now. There's like terrible things happening in the world. Somebody just died. Like, yes, that is 100% true. But those are really kind of unhelpful. Those are kind of unhelpful attitudes. And the reason is because that suggests that in order to use medication to be helpful to you, either you need to be in a horrible situation so that you're not functioning, you're close to the edge of your rope, you're about to crash. That's one thing. And the other thing is that because something bad happened to you, it's perfectly appropriate for you to feel sad, and therefore medication won't help you. And that you can only go on medication to help you with your sadness or your anxiety if there's no reason to be sad or there's no reason to be anxious. And then it becomes appropriate. Then it's okay to go on these medications. So that's a terrible way to think about it. And I want to sort of reframe this and help you think about it in a different way. So how do these medications work? These medications fall in a number of different classes, but one way or the other, for the most part, they all work on neurotransmitters. And neurotransmitters are in your brain. They function by often sending signals from one to the other. And some people have way more neurotransmitters than other people do. That's the way you were born. It's kind of like, I'm 5 feet, nothing and a half inches. I wish I was 5'5", but I'm not. Some people have more neurotransmitters and some people have less neurotransmitters. And some people's neurotransmitters are way more sensitive than others. Some of them are overactive. So that the same thing can happen to person A and can happen to person B or me, for example, and I would get very, very anxious from that, or I would get very, very depressed from that, and somebody else, it may kind of slide off their shoulder and they don't get depressed. Somebody may react to something by getting severely depressed, and somebody else may react by getting mildly depressed, and somebody may get super anxious and somebody else may not get anxious. We all know people that are not anxious, right? Like, we all know people who it just feels like life just rolls off their back. Nothing seems to throw them. Different people are built differently, and that's fine. That's totally fine. We just need to acknowledge that that's the case. And so what happens is when you are somebody who has either a lot of neurotransmitters or very sensitive neurotransmitters, it's a biological difference, and you're going to respond to things differently. So you may feel something much worse than somebody else. So if we're all living through this coronavirus, and I'm just going to grab my tea here because it's going to slow me down a little. If we're all living through this coronavirus, which is pretty horrific on every level, some people are going to respond with way, way higher levels of anxiety than other people will. And some people are just going to get much more depressed than other people will. So that's number one. Number two, all of us have our own coping skills, and for different people, different coping skills work well in different situations. So, for example, my tremendous coping skill is that I move faster and more efficiently, and I do more. So if there's a lot of things to do, I can jump into those situations and I can run around like a maniac and get a lot of things done really efficiently. And that's coping, and that works really well in certain environments. It doesn't work really well in an environment where I'm stuck at home, under house arrest, basically, like everybody else is right now. So I just want to reintroduce myself and say I am Batsheva Marcus, and I'm just talking about the use of medication and our hesitation as a society to use medications when they may be extremely appropriate. So you may be somebody who's like very quiet or handles things very well, but then maybe when you hit up certain things, you get a level of sadness that just doesn't work in your favor and it's not working well for you in this situation. So if you start thinking about anxiety and depression and people's response to them as something where it has to do with biology, how many neurotransmitters you have, how sensitive they are, and your general coping skills for things, like you're better in certain situations than others, then you may start thinking about this medication you may start thinking about the medication piece a little bit differently and a little bit more respectfully of yourself. Because if you're in a situation where a bad thing's happening, a lot, let's say it's not COVID-19. Let's say there's a death in your family, God forbid. So a lot of people handle deaths, but some people, it makes them much sadder. Some people just go into this place of sadness that other people don't. And that's not because there's anything wrong with them. And that's not because they're not as strong as somebody else. I don't even know what that means. It has to do, again, with their personal biology and their personal coping mechanisms. So if that person would do better with being on medication, that's an amazing thing. And we should look at medication as a tool that can be incredibly helpful to us. So I think people have to stop thinking about medication as a crutch or as something that means that there's something wrong with you, right? I mean, if somebody could give me medication that would make me 5 inches taller, I think I would take that medication because I was just born very short. So you might want to think about the fact that if you use medications and you start feeling better, that does not mean you'll be on the medication for the rest of your life. So let me talk about a couple of different kinds of medications, of antidepressants and anti-anxiety medications, because I think that could just be helpful so you can understand that there's distinctions between them. So classically, when we think about anti-anxiety medication, we think about, and sometimes antidepressants too, we think about something called SSRIs and SNRIs, serotonin reuptake inhibitors. And those tend to be long-term, and by long-term, I do not mean 10 years. By long-term, I just mean it takes a few weeks for them to kick into your system, right? As opposed to some other drugs that kick into your system almost immediately and are out of your system almost immediately. So those classic SSRIs and SNRIs are the ones you hear about all the time. There's Prozac, Effexor, Lexapro, Celexa. There's a huge number of them, and there's more coming out every day. And people really like them because they kind of even out. They really flatten the emotional curve. I mean, I hate to do it, but they do. But that doesn't mean they flatten you. So I'll just personally say, I remember the first time when I went on Prozac, this had to be, 25 years ago, and Prozac was just coming out on the market or had just been out for a year or two. And I remember going on Prozac and thinking at the time, oh my God, this must be what normal people feel like. Like, I'm not thinking about the same thing again and again and again and again. That doesn't mean I stayed on Prozac forever. There was something going on in my life at that time that made it particularly hard for me to handle the anxiety. But I did go on the Prozac, and I remember feeling a significant difference in terms of just the wheels continually turning. So often when you talk to physicians, you'll hear about SSRIs and NSRIs. There are very many other class of drugs for depression and anxiety. Bupropion you might have heard of. You've heard of it as Wellbutrin. That works on norepinephrine, but it doesn't really help usually so much with anxiety. There are the tricyclics, so you might have heard of Elavil, also working on neurotransmitters. All of those drugs tend to be drugs that you need to take for a couple of weeks until you start to see the difference. The drugs that people talk about that you take short-term, very short-term, are the benzodiazepines. So Valium, Xanax, Prozac. Prozac's an SSRI. Valium, Xanax, there's a whole bunch more. There's a gazillion of them. Those are the ones that you take that make you feel better, like after about, 10 minutes, a half an hour. They work very quickly and they're in your system overnight. They're in your system for like 6 hours or 8 hours. I said overnight because when I'm having sleeping problems, sometimes that could be super helpful to me. So the deal is to find the right medication for you. Are you somebody who needs to use something just once in a while, and then there are certainly appropriate medications for that? And are you somebody who wants to use something more long term, in which case you want a different kind of medication? So now are things to think about if you're thinking about medication. Again, you should call your primary care physician to start with. it's actually quite easy these days because most every doctor is seeing patients through telemedicine, telehealth. So you can usually call the office and get an appointment, and it might be a good time for you to consider doing that. Once you're on a medication, you can stay on it for a few months and then make an educated decision about whether or not it's working for you. I often will recommend to patients that they do that because if you never tried it, you don't really have an educated decision. If you're just scared of it, you're just making a decision based on hearsay from other people, and it's really not that super helpful. You can remember that it's not going to be a lifetime commitment. If you get on a medication, you can stay on that medication and be on it for 6 months or a year. And during that time, you can still be doing your therapy, doing your meditating, exercising, doing all the other things that will really help your body kind of regulate itself to be able to manage the stress or the depression, and then you can get off it. You should think of medications as one more tool in your toolbox rather than I'm either on medication or I'm off medication. You should know that there are now saliva tests like Genomind. There's a few of them where you can send away and they will let you know which of the antidepressants or which of the medications or the anti-anxiety medications will be most effective for you, which ones may have more side effects for you, which ones you may need higher doses of. It's a new science, so they don't have it down 100% yet, but people find it very reassuring to know that they're going on a drug that's specifically for them. So you can consider that. You also shouldn't be worried about all those side effects that we talked about. Most drugs do not flatten your personality, but if you start feeling like that's the case, you'll get off the drug. Some drugs have side effects like weight gain, but many of them do not. And so again, just because something sometimes has a side effect doesn't mean it will happen for you. And again, it's just not a lifetime commitment, so you can just try it. So I would really highly recommend now. I think now is kind of a great time for people to be thinking about whether or not an anti-anxiety medication or an antidepressant is going to make sense in your life. There's a lot of stuff that's really hard for people going on now. And as I said way in the beginning, just because things are terrible now doesn't mean that you therefore shouldn't use medication. That means that medication may help you get through this if you're somebody who reacts to things in a way that's not helpful. You don't have to wait until you're at a breaking point before you decide, oh my God, I should do the medication. You do not have to be somebody who's like not getting out of bed or can't stop crying. That's ridiculous. You can use medication just the same way that you use exercise, meditation, talking to your friends. All of those are tools, and appropriate medication is a tool as well. So I'm going to recommend strongly that you get in touch with a primary care provider now if you feel like you need some medication to help you through this tough time or any tough time, that you not be judgmental about yourself when you need some chemical help to help you through these times, that you're just kind to yourself about it, and that you realize that you're fine, that lots of people have been on and off lots of different medications, and it's going to be fine if you try it and then you decide, great, it worked great, I'm on it for 6 months, or I'm on it for a year, or I'm on it for 5 years, and then I don't need it anymore, or I'm going to try without it and see how I feel. And then you are making a really educated decision. I have gotten a couple questions about weight gain. I know that's a very big concern for a lot of women on medications. Again, when you get prescribed a medicine, just say to your primary care provider or whoever you're talking to that is a concern of yours. Certain medications have more of an impact than others on that. Many of these medications do indeed have some sexual side effects, like lowering libido, making it harder to have an orgasm. That absolutely happens. However, just because it's a possible statistic, it doesn't mean that it's going to happen to you. So again, I will tell you the two medications that are currently out there, the two SSRIs, or they may be SNRIs, that have less sexual side effects or claim to are Vibrid and are Trintellix. They may be the ones you want to go to if sexual side effects are your concern, but mostly I would say to you, don't make assumptions about what your problems will be. Just talk to a doctor, explain your situation, and try it. You can try it, and then you can try a different one if that one's not working for you. But don't get overwhelmed by the prospect, because it can be an incredibly powerful, helpful tool for you. And that's it. And I thank you so much for all the people watching. I'm seeing a whole bunch of therapists here, so that's awesome. And I really appreciate it. And give me topics that you want me to cover as I'm going along as I'm learning how to do these lives on Facebook. Thanks so much.